This is our new arm car. It's a Ford Transit chassis, essentially a van type of ambulance. We made a few modifications that are helpful for us on the arm car. One of those is we have an exam light in there, because one of the main reasons I wanted to have an ambulance is so that we can bring our patients into a private area if we needed to do sutures or needed to do any type of invasive procedures. So it's nice to have the room to bring someone out of the weather, out of their work, and to a more private area. And then essentially it's also equipped to where we can respond as first responders essentially to more critical calls when we're out and about. So it has all of the normal advanced life support equipment as a typical ambulance. And then we have our additional kits that are specific to the ARM program.
I think we have one of two options right now.
The ARM car provides an alternative level of treatment care where we can treat patients on scene, avoid unnecessary emergency room transports, and also provide them with additional resources outside of their immediate medical needs.
They're willing to get like a home health aide to kind of come help you with just some things around the house here and there. And
we've also tried to expand our social service navigation, and that's really where we help citizens in the community who need to get connected with resources, whether it's finding shelter or clothing or food, or even getting connected with primary care, or getting into insurance, or finding really whatever they need outside of their immediate medical need. Just slide this on your finger. It's really set up to follow the model of what's called mobile integrated healthcare, and essentially it's providing the immediate medical needs, but then also plugging them in to what they need in the future. It's not to take the place of a primary care physician, so many times we'll utilize primary care to help meet the patient's needs. So if we show up and they happen to fall and have an injury, we can help treat that injury, but also we're worried about the long-term issues that might come from that injury, whether it's subsequent falls. They might just be generally getting weaker due to their disease process and they need more help at home. So we can utilize primary care to get other resources into their home for those more long-term care needs. And then really we can try and meet whatever social need they have as well. Ideally we are plugged into the community enough to where we know what's available, and then we just connect the patient to the resource. Yeah, we'll take care of all that. We're continuing to see more patients. We have continued to add services that it can provide, and currently the forecast of healthcare is ensuring that the arm car is going to be around for a long time.
okay, so you can take that every 6 hours, so you're probably ready for another dose. Would you like some more Tylenol?